So it's a great question, and it clearly is the right time to do it, but it's also evidence of why people need to get a vaccine. If there was ever a motive to vaccinate, this is it. So at Westchester Medical Center, as you know, we've overseen about 1.3 million vaccines, and here we've given at our institution and at the county center that's overseen by the medical center about 500,000 vaccines. And the good news is in the Hudson Valley, about 55% of the people have had at least one dose. So it seems very reasonable that for large gatherings indoors, you should stay masked. For outdoors, especially if you've been vaccinated, you don't need to mask. And if you're outdoors and you're unvaccinated and you're not around other people, it would be reasonable to unmask. But if you're in a group that has partly vaccinated and partly unvaccinated people in a small area, you should stay masked, because the vaccines, although they protect us, are not 100%. And our goal is to keep this vaccine ongoing and to prevent a recurrence of the high numbers of COVID that we've seen over the last 18 months. And clearly this vaccine works.
So you did a good job there of explaining exactly what the new guidelines mean for everyone in a day-to-day setting. What's the big takeaway here? I mean, even for folks who are vaccinated, many say, wait a minute, I've been vaccinated. Why do I still need to wear a mask even around people who haven't been vaccinated? What do you tell them?
So one issue is that although the vaccine is about 95% effective, it's not perfect. And that means that you want to be as careful as you can be. And the other issue is, you heard from the CDC today, not everyone knows who's vaccinated and who's not vaccinated. And good public health and good protection means that we want to stay vigilant. And so if you're in a large gathering with lots of people, it's safer to wear a mask than to take a chance. And that's what this recommendation is all about, to be safe, to be rational, and to keep ourselves at a high vigilance so that we keep this under where we have it today, which is very nice reductions in the number of COVID positive cases.
I certainly want to keep those numbers heading in the right direction. So what about indoors then? What do we tell folks who, again, maybe they're vaccinated, maybe they're not? How do they handle the indoor setting?
So some of that depends a little on where you are. If you're indoors with your family and you're vaccinated, take off the masks, enjoy each other. If you're indoors and you're at a barber shop, for example, and there are other people around you, the safest thing to do would be to keep your mask on. And it's not that difficult to do it. It's not a problem to stay masked in those kind of settings. So part of this is just common sense. If you're at the New York City subway, even if you're vaccinated, you may feel safer keeping your mask on because some of the people around you have not yet been vaccinated. And you'll see that as you're showing on the website, it's made very clear. It's very easy for people to follow this now and to decide, should they take their mask away and can they get back to a little bit more of what we consider to be normal, or should we stay masked? And as a healthcare provider who's seen COVID with hundreds and hundreds of patients hospitalized, it's a very small sacrifice to make for the greater good of the public.